By late February, the coronavirus outbreak in northern Italy meant that Milan's Piazza del Duomo, normally bustling with tourists, was as quiet as a small town. Even as small towns in the Lombardy region found themselves surrounded by checkpoints and crowded with ambulances. At the time, my team and I were barred from accessing quarantined areas, so we spoke to volunteer medic Marco Frigoli in the town of Casalpusterlengo on Skype.
I don't live alone, so every time I go back home I think about it, because maybe I've been in contact with someone that has it.
By March, COVID-19 was ravaging Italy, and a strict nationwide lockdown was imposed. In the small southern town of Moliterno, one doctor wasn't just battling COVID-19, but also the stigma that came with it.
From a human point of view, COVID-19 has been devastating for me. Because my wife was the first confirmed case in the whole Basilicata region, it's unleashed an incredible wasp nest around me, related to the gossip, those who thought that I was the one who brought this virus to our area.
In the summer and autumn months, Italy seemed to get its outbreak under control. But as winter approached, concerns were growing again. By the end of the year, the number of Italians dying from coronavirus in the country's second wave of infections surpassed the toll from the first wave. When we caught up on Skype with Giuseppe Spina and his wife Carmela, they told us that they saw only one viable way forward.
Our family feels a little bit more serene and safe because we have developed a share of antibodies, and this has allowed us to keep afloat so far. But I truly believe that the vaccine is the only solution out there. Otherwise, we will never overcome it.
As news emerged that the new variant of coronavirus had been discovered in Italy, the rollout of the coronavirus vaccine has helped many feel a renewed sense of hope. Like Marco Frigoli, who, when we checked in with him again, said he was happy about all the prospects that came along with being vaccinated.
To go back to our human interactions as they were before, the idea that it can give us the chance to hug each other without any concerns, the thought of being able finally to reopen our businesses and everything that comes with it.
A surge in the number of coronavirus cases meant the country returned to lockdown over the Christmas and New Year period. At the Vatican, St. Peter's Square, usually packed with the faithful, sat empty. Even as Italians hoped and prayed for a much safer and far happier 2021. Mohammed, Jamjoom, Jazeera.
Dr. Gloria Tagliani is a professor of infectious diseases at La Speranza University in Rome and joins me now from Avellino. Doctor, good to have you with us again on Al Jazeera. We saw you on Sunday, of course, taking the vaccine live on our programme.
Yeah.
How are you feeling?
Oh, perfectly well, thank you, and safe.
That's great to hear. Now, Italy seems to be in the second wave of the pandemic. As a medical expert, how do you assess the situation across the country, considering it recorded just over 16,000 cases on Wednesday?
Well, the number of cases is slowing down, although in a very inconstant way, because some days the number is growing, the other day is decreasing. So, but overall, the curve is in a decreasing shape. Therefore, we are confident that the second wave is declining. We have some concerns about the possible occurrence of a third or a reclimbing of the curve after the Christmas holidays. But we will see. In any case, the situation is changed because now we have the vaccine and people are less concerned about the risk in a way, but more conscious about the need of staying safe up to the moment they can have the shot.
Would you say that? May I just interrupt there? Would you say that is actually the way Italians feel? Because the government is saying that taking the vaccine is not mandatory, which opens up the issue of whether the population is more vulnerable with those members or those Italians that don't want to take the vaccine at all. And there is a large number of those anti-vaccination type of voices across Italy.
Well, it's not a large number. It's a number, of course, as in any other country, I think. But the population really want to be vaccinated. There's a small proportion of people that are not willing to receive the protection against the virus. Even if we have some concerns about the new variant and the possibility that the vaccine could be less effective in such instances, nevertheless, the willingness of being protected somehow, which is a great difference compared to the previous moment when we had nothing but our particular attention and how being careful is a very important change of landscape. And I feel this in the contacts with people and with patients. All of them are really willing to receive the vaccine, the vast majority of them.
Speaking to various virologists around the world in the last few days, many say the same things, that to reduce the chances of any more mutant strains of the virus, it's very important for a large section of the population to get the vaccination and to maintain the social distancing, the washing of hands, and perhaps not touching other people until you are vaccinated.
Yeah, these are two different measures which are not excluding each other. They should work together and make safest the condition of the people who have to start working again and have to teach in the school and have to make a possible normal life. Nevertheless, we have to consider every day that the virus can spread, the virus is everywhere, and so we have to keep social distancing. This is extremely important, and keep the masks on, because even if we are vaccinated, we can carry the virus and distribute, because the vaccine protects against the disease, not the infection. And this is very important. People should know it.
Indeed, I'm sure they do now. Dr. Gloria Taliani, it's good to see that you're well, and thank you very much for your insight again.
Thank you.